Pityriasis rotunda, or PR, is a rare skin condition. It causes unique round patches on the skin. These patches are scaly and well-defined. While uncommon, PR is important. It can be a sign of other health problems. Doctors and dermatologists need to understand PR. Early diagnosis and treatment are key. This can help patients manage their condition and any underlying issues. PR is often a mystery. Its exact causes are still being studied. However, we know it can affect people of all ages. Early diagnosis and treatment can make a big difference in a patient's life. PR was first described in the early 1900s. Initially, doctors thought it was a type of ringworm or eczema. This is because of the round shape of the patches. Over time, PR was recognized as a distinct condition. PR is more common in certain groups. These include people of African, Asian, or Mediterranean descent. It is also more common in adults than in children. The exact cause of PR remains unknown. Some theories suggest it might be linked to genetics, the environment, or even nutritional deficiencies. More research is needed to fully understand this complex condition. The exact cause of PR is still unknown. However, there are two main types. These are based on whether it's linked to other health problems. Type 1 PR is linked to underlying medical conditions. These can include liver disease, cancer, or autoimmune disorders. It's thought that the body's immune system might play a role in these cases. Type 2 PR is not linked to other health problems. This is known as the idiopathic form. It's more common than type 1. While the cause of PR remains elusive, ongoing research seeks to shed light on its complexities. Understanding the underlying mechanisms could pave the way for more targeted and effective treatments. PR has distinct symptoms. Recognizing these is crucial for early diagnosis. The most noticeable symptom is the appearance of round or oval patches on the skin. These patches are usually scaly and have a well-defined border. They can range in size from a few centimeters to several inches across. The patches are often brown or gray, but they can also be reddish or darker than the surrounding skin. PR patches are usually not itchy. If itching occurs, it is typically mild. The patches most commonly appear on the torso, buttocks, and limbs. However, they can occur anywhere on the body. Section 5. Distinguishing PR from other skin conditions. Pityriasis. Rotunda can look like other skin conditions. These include ringworm, eczema, and psoriasis. That's why it's important to see a dermatologist for diagnosis. A dermatologist will examine the skin and ask about medical history. They may also take a small sample of skin or biopsy to examine under a microscope. Differentiating pityriasis. Rotunda from these conditions is essential for appropriate treatment. While some treatments may overlap, others are condition-specific. Accurate diagnosis ensures the most effective management plan. Section 6. Unlocking the clues, biopsy and pathology. A skin biopsy can help diagnose pityriasis rotunda. It can also rule out other conditions. A small sample of skin is taken and examined under a microscope. The biopsy results can show changes in the skin cells. These changes are characteristic of pityriasis rotunda. They can help confirm the diagnosis. The biopsy can also help determine if there is inflammation. This information is helpful in guiding treatment decisions. Section 7. The journey to diagnosis. Diagnosing pityriasis rotunda involves several steps. The first step is a physical exam. The doctor will examine the skin and ask about medical history. If pityriasis rotunda is suspected, the doctor may order a skin biopsy. This helps confirm the diagnosis and rule out other conditions. The doctor may also recommend blood tests. These tests can check for underlying medical conditions. Early diagnosis is important for effective management of pityriasis rotunda and any associated conditions. Section 8. Treatment strategies for pityriasis rotunda. Treatment for pityriasis rotunda depends on several factors. These include the type of pityriasis rotunda, the severity of symptoms, and the patient's overall health. For type 1 pityriasis rotunda, treating the underlying medical condition is crucial. This can often lead to improvement in the skin patches. For type 2 pityriasis rotunda, Treatment focuses on relieving symptoms. This may involve topical creams or ointments to reduce scaling and inflammation. In some cases, oral medications may be prescribed. Section 9. Living with Pityriasis Rotunda, prognosis and follow-up. The prognosis for Pityriasis Rotunda is generally good. For type 2 Pityriasis Rotunda, the condition often resolves on its own over time, however it can sometimes recur. For type 1 Pityriasis Rotunda, the prognosis depends on the underlying medical condition. Regular follow-up with a dermatologist is important. This allows for monitoring of the condition and adjustment of treatment as needed. It's important to remember that Pityriasis Rotunda is manageable with the right care.